Good afternoon, everyone. I really appreciate this opportunity to talk about our joint work between DTRF and SpinWorks. Thanks Amanda, Kelly, and Lynn for their great partnership. As we are getting more familiar with desmoid tumors today from prior presentations, I would like to add another critical aspect, the financial burden, as one key component of the overall disease burden that many of you may have personally encountered or struggled with. This is my disclosure. I'm an employee from SpinWorks. So the first question is, what is financial burden? Briefly speaking, it's about the stress on the amount of money, time, and effort patients spend by dealing with desmoid tumors. For example, if a medical bill is large, it may force hard financial choices like cutting necessary follow-up care or medical doses, which could lead to more serious health problems later on. So our work aimed to better understand such financial stress based on patient-reported data from DTRF natural history study. If you are unfamiliar with DTRF natural history study, it's part of the National Organization for Rare Disorders, IM-RARE program, and it has been collecting data for the past 8 years, and it will continue collecting data going forward. DTRF registry contains a total of 15 patient surveys that help the DTRF, the healthcare providers, and the researchers better understand desmoid tumors over the course of patient lives. Out of the 15 surveys from DTRF registry, Profit was selected to assess the financial burden in desmoid tumor patients by collecting information on patient-reported outcomes for fighting financial toxicity. It contains an overall evaluation of the financial toxicity outcomes, plus 3 key factor areas, including medical expenses, transportation challenges, and healthcare support. In addition to a summary of financial toxicity, we also analyzed how this can impact desmoid-specific pain and function, and got this tool developed by DTRF for Gonder DTRF symptom impact scale was used to assess desmoid-specific pain and function. First, let's take a quick look about the demographics from the 107 participants from the Profit survey. As expected, majority were female, white, living in the United States, similar to the overall population from the DTRF registry. And desmoid tumor can develop anywhere across the body. By 2023, about half of participants still reported a presence of current desmoid tumor, and a similar proportion reported a prior desmoid treatment. Our analysis summarized the financial toxicity for these 3 subgroups as well to assess if any difference for specific group of patients. As many of you may have experienced, living with a desmoid tumor can be frustrating, and some of this frustration may come from the gap between the impact of desmoid on your daily lives and your expectation in pursuing a care for life changes. Some of you may have experienced multiple scans prior to diagnosis, and some of you may have learned that desmoid is benign, not a cancer, seems nothing to worry about. So your struggles with desmoid are taken seriously. We analyzed the DTRF registry data and found that desmoid can have a financial toxicity similar to, if not worse, than some malignancies. It is second worst to the breast cancer, followed by GI, colorectal cancer, and cervical cancer, suggesting that the financial burden in desmoid tumor patients is substantial, although the disease itself is benign. In our subgroup analysis, we found that patients with the presence of a desmoid tumor reported worse financial toxicity than those without a presence of a desmoid tumor. In addition, the financial toxicity was similar to the overall assessment, no matter whether a tumor location, where a tumor was located, or whether patients had a prior desmoid treatment. So what's the impact of this on patient lives? Based on our association analysis, we found that the financial toxicity in desmoid can have significant negative functional impact, including sleep, physical functioning, and emotional aspects. What's driving this? As noted from this table, the top drivers included medical expenses, followed by transportation challenges. For example, the top row for this table, we find a significant link between medical expenses and all the three functional aspects: sleep, physical functioning, emotional impact. That means patients who are struggling with financial stress, like healthcare expenses, then more likely they are going to feel hopeless, anxious, or depressed. And additionally, they may not be able to sleep well or not able to do moderate to vigorous daily activities. So this part is very helpful for us to understand the impact of desmoid on the mental health for patients. In summary, desmoid can impose substantial financial toxicity similar to, if not worse than, some malignancies. For example, G1 colorectal cancer or thoracic cancer, suggesting the financial burden in desmoid is significant, although the disease is benign. We hope this information can help raise awareness among our desmoid community of the financial challenges and how they can impact quality of life. We also hope this information can be used to improve the access to care for patients. Lastly but not least, the authors wanted to acknowledge the contribution from the DTRF natural history study. Thanks each and every one of you, your caregiver, your families, your caregivers. Your continued engagement with DTRF is much appreciated. Thank you.